Okay, so the parathyroid gland, the structure and functions of the parathyroid gland. Okay, so in this video, we'll be focusing on the parathyroid gland and then the hormones that are produced by the parathyroid glands. Okay, please kindly support this channel by clicking on the like button. If you've not subscribed to the channel, do well to subscribe and also make an attempt to share this video and content on this channel to friends who may find the contents very relevant. Now, the parathyroid glands. Okay, the parathyroid glands are also called the epithelial bodies. Okay, the epithelial bodies. Okay, and these glands are very small glands. They are small glands in the neck that regulates the body's calcium levels. Okay, the parathyroid glands. We also call them the epithelial bodies. And these glands are very small. In fact, these glands are 4 in number. Okay, and they are very small glands in the neck that regulates the body's calcium level. Now, like I said, typically they are 4 tiny glands, about 3 to 8 mm long. Okay, and they are embedded on the posterior surface of the thyroid gland lobes. Okay, and just like the thyroid gland, these glands are also highly vascularized and encapsulated. Okay, so this is where they are located. So you see, this is the posterior view of the thyroid gland. So these glands are actually at the back or behind the thyroid gland. Okay, this is the anterior or front view of the thyroid gland. This is the back view of the thyroid gland. So at the back view of the thyroid gland, we have the parathyroid glands. 1, 2, 3, 4. They are 4 in number. Let's look at the back view of the thyroid gland on this diagram. Okay, so 1, 2, 3, 4. So these are the parathyroid glands. Okay, like I said, they are located on the posterior side of the thyroid gland, behind posterior side of the thyroid gland. Is that okay? Good. Now, if you take a unit of them, like one of them, this is how it looks like in its cellular distribution. So this is the thyroid gland. Okay, so we have chief cells, which are the main cells within the parathyroid gland. This is how the thyroid gland looks like. And we have the oxyphil cells. Okay, the oxyphil cells. Okay, we also have some red blood cells within this gland. Okay, so we will come to more details of this diagram again. All right, so now each of these glands consists of 2 cell types. So we have 2 cell types in the parathyroid gland. We have the chief cells, which are the principal cells, and then we have the oxyphil cells. Okay, and they are arranged in clusters with blood-filled sinuses in between these cells. Okay, so basically we have 2 main types of cells in this parathyroid gland. Okay, the chief cells, which are the principal cells, or you can even call them the principal cells of the parathyroid gland. And then we have the oxyphil cells. Okay, the oxyphil cells. Okay, now it's the chief cells that secrete the parathyroid hormone, and then the oxyphil cells functions is less clear, but you know, it also supports the chief cell or the principal cells in producing the parathyroid hormone. And in this cell, the activity of this cell is known to become more active. Okay, it's known to become more potent when you age. Okay, or when you become an elderly. Is that okay? So we have 2 main cells, the chief cells and then the oxyphil cells. In fact, they all contribute in producing or secreting the parathyroid hormone. Okay, so this is what we are talking about. So we have 2 main types of cells in the parathyroid gland. We have the chief cells and then we have the oxyphil cells. Okay, and together they all help to produce the parathyroid hormone. Okay, so the hormone secreted by the parathyroid gland is the parathyroid hormone, or you can call it the parathyroid hormone. Is that okay? The parathyroid hormone. Okay, good. Now, in fact, is the sole hormone secreted and plays a role in calcium to phosphate hemostasis. Okay, now what are the functions of the parathyroid hormone? Parathyroid hormone works to increase your blood calcium level, You remember the thyroid gland produces a hormone called calcitonin. Okay, the parafollicular cells of the thyroid gland, it produces a hormone that we call calcitonin. The calcitonin works to lower your blood calcium level, but here, the parathyroid hormone, okay, it works to increase your blood calcium levels. The parathyroid hormone, okay, it works to increase your blood calcium level. How is he able to do that? Okay, it does this by stimulating bone resorption, that is osteoclast, and also increasing renal calcium reabsorbing. Apart from that, okay, this hormone also promotes phosphate excretion. It promotes phosphate excretion. Is that okay? And then it also activates vitamin D, which is calcitrol, to enhance gut absorption. Okay, so that should tell you that if someone is having a hyperactivity of the parathyroid gland, there will be hypercalcemia. At the same time, okay, there is going to be hypophosphatemia. Phosphate levels will go down because, see, we are saying that this hormone works to increase your blood calcium level. It also promotes phosphate excretion. It also promotes phosphate excretion. Okay, so whilst it is working to increase your blood calcium level, it is also working to reduce your blood phosphate levels by promoting phosphate excretion in the kidneys. Okay, so this is something very key you have to take note of. Is that okay? Good. And from this, you can also get that understanding that with the calcitonin would also work to decrease your blood calcium level whilst increasing your blood phosphate levels. So usually when calcium levels are going down, phosphate levels goes up. When calcium levels are going high, phosphate levels go low. Is that okay? You should get this principle. It's very simple. Is that okay? Good. So that is it for the functions of the parathyroid hormone. Okay, so the parathyroid hormone acts antagonistically to calcitonin. Is that okay? To the calcitonin from the C cells of the thyroid gland to maintain stable calcium levels, essential for muscle contraction, nerve impulse transmission, clotting, and enzyme function. Is that okay? Now, if you understand the parathyroid hormone, okay, clinically, it would help you to, especially if you understand the parathyroid anatomy, it will help you in managing hypocalcemia. It will also help you to appreciate hyperparathyroidism and then post-thyroidectomy complications. Yeah, because post-thyroidectomy, you would understand that because of the location of the parathyroid glands, the parathyroid glands can be accidentally removed. There can be accidental removal, and that can cause a life-threatening calcium imbalance. Is that okay? Good. So these are the parathyroid hormones. 1, 2, 3, 4. These are the parathyroid hormones. Okay, and we've taken one of the these are the parathyroid gland. We've taken one of the glands. Okay, and we have chief cells and oxyphil cells. These two cells all help to produce the parathyroid hormones. Okay, and the parathyroid hormones, what they do is that they work to increase your blood calcium levels. They work to increase your blood calcium levels. It's actually an antagonistic hormone to the calcitonin, because calcitonin works to what? Calcitonin is a hormone that works to lower your blood calcium levels. And we are saying that the parathyroid hormone, they work to increase your blood calcium level. At the same time, they work to decrease your blood phosphate levels by promoting phosphate excretion in the kidneys. Okay, so whilst parathyroid hormone is helping to increase your blood calcium level, at the same time, it is promoting excretion of phosphate in your kidneys. This is something you have to understand. The same thing applies to calcitonin. Whilst it is working to decrease your blood calcium levels or reduce your blood calcium levels, it is promoting phosphate reabsorption in the kidneys. They work antagonistically. Is that okay? This is something that you should know. Is that okay? Good. So here are the parathyroid glands. Here are the parathyroid glands. Is that okay? Here are the parathyroid glands. They are located at the back of the thyroid gland. So there's the thyroid gland, and you see the parathyroid gland at the back. So in a surgery too, for example, someone is going to do total thyroidectomy. They are going to remove the entire thyroid gland. You know that accidentally, as a nurse, when this patient is coming, you should know that accidentally, if care is not taken, the parathyroid glands can be removed because of where they are located. Okay, that is what we are talking about. So if you understand the parathyroid gland anatomy, you appreciate the fact that if this patient come back from theater, you have to be assessing the patient's electrolyte levels. What do you pay attention to? The calcium levels, okay, and then the phosphate levels. Because if the parathyroid gland is accidentally removed, it means the person may have to be on calcium for the rest of his or her life. Is that okay? That is what we are talking about. Is that okay? Now, another thing that you need to note is that if you are asked the target organs, okay, in anatomy, we ask you to list the target organs for the parathyroid hormone. The target organs, one of them is the bones. Okay, the target organs for this the parathyroid hormones, that's the hormones produced by the parathyroid gland. The bones are one of them. Is that okay? Because you remember I told you the parathyroid hormone stimulates osteoclast activity in the bones, meaning breaking down of the bone matrix. It stimulates the breaking down of the bone matrix so that calcium will be removed. Once the bone matrix is broken down, then calcium will be released. That is, calcium and phosphate will also be released into the bloodstream. Is that okay? Good. And it's also what? Parathyroid hormone also targets the kidneys. Is that okay? It increases calcium reabsorption in the renal tubules. And this is how the parathyroid hormone is able to what? Increase your blood calcium level. So it uses two mechanisms. So first, it can stimulate bone breakdown, the breakdown of the bone matrix. Is that okay? Osteoclast activity. Okay, so that as the bone matrix is being broken down, it will release calcium and phosphates into the bloodstream from the bones. Okay, and that will increase the blood serum calcium levels. Okay, another thing is that it can act on the kidneys to increase calcium reabsorption back into the blood. Okay, but whilst it is acting on the kidney to increase calcium reabsorption, anytime calcium is being reabsorbed, phosphate is being excreted. Is that okay? That is what happens. That is why we say that this hormone, parathyroid hormone, it plays a role in increasing calcium reabsorption or increasing blood calcium level whilst promoting phosphate excretion. You have to understand this principle. Is that okay? Are we good? So it can also even act on the intestines. Is that okay? It can act on the intestines so that the intestines, within the intestines, the absorption of calcium will increase in the gut. Okay, absorption of calcium and phosphate will increase in the gut. Is that okay? Yes. So what you have to note is that this hormone produced by the parathyroid gland, they act on bones, they act on the kidneys, they can also act on intestines, whereby they cause calcium absorption. Do you get it? Good. So basically, that is it for the parathyroid gland and then the parathyroid hormone. So that should tell you, as a human being, you need a normal parathyroid function. A normal parathyroid function to help increase your blood calcium levels. A normal parathyroid function to help decrease your blood phosphate levels, because the parathyroid gland, that helps to decrease your phosphate levels. Okay, by increasing your phosphate levels, by increasing phosphate reabsorption in the kidneys, at the same time it is decreasing phosphate levels. Is that okay? So it also acts on bones, it acts on kidneys, it acts on the intestines, and we've looked at how it acts on the intestines. Now, if the parathyroid gland is overworking, let's assume your parathyroid gland is overworking, or there is a hyper secretion of parathyroid gland, you know definitely there is going to be hypercalcemia, meaning your blood calcium levels will increase. You know definitely there is going to be hypophosphatemia, meaning an increase in the amount of phosphate loss in the blood. Is that okay? And the person may have signs like once the blood calcium level is increasing, you are at risk of getting stones. Do you get it? Stones forming in organs like kidney stones. You get it? Conditions like osteoporosis. Do you get it? That will happen when your parathyroid gland is overworking. You would be at risk of muscle weakness. Do you get it? You will be at risk of polyuria, polydipsia because of the hypercalcemia. Okay, it will make you urinate a lot. Is that okay? Now, if the parathyroid gland is underworking, that condition is called hypoparathyroidism. Okay, if the parathyroid gland is overworking, that is hyperparathyroidism, which we've looked at. If the parathyroid gland is underworking, that condition is the hypoparathyroidism. Okay, and usually it's as a result of accidental removal or damage during a thyroid surgery because of the location, anatomical location. Is that okay? Good. So in such a situation, the patient can have signs like seizures. That is, the parathyroid gland is underworking. Hypoparathyroidism. Signs like seizures, signs like arrhythmias, breathal nails, tetany, tingling and numbness, muscle cramps, muscle spasms. You get, because of less absorption and more excretion of the serum calcium. Do you get it? So basically that is it. Okay, so if your parathyroid gland is underworking, you are going to have less absorption of calcium, more excretion of serum calcium. Okay, and then your phosphate levels will go high. If someone is having hypoparathyroidism, it means that the parathyroid gland produces the parathyroid hormone. What the parathyroid hormone does is it increases calcium levels, decreasing phosphate levels. So if your parathyroid gland is underworking, hypoparathyroidism, your calcium levels will rather increase. Phosphate levels or phosphate excretion rather will decrease. And that is when you are going to have all these signs we are talking about, like Votex sign, Trousers sign, seizures, arrhythmias, breathal nails, muscle cramps, muscle spasm, tingling and numbness. You are going to have all these signs. Is that okay? All right. So basically, that is it for parathyroid glands.